I thank the organizers for giving me this opportunity, especially Dr. Krishnaveni madam. And this topic is very close to my heart. So this field of neurology in pregnancy has evolved so much. I can tell you my father used to practice, though he's a surgeon, he used to practice gynops. Now my daughter is doing neurology. And I heard that there's a subspecialty developing in US, women in neurology. So that's the evolution of this. I don't know how can this one do it within 15 minutes. So now, what are the neurological issues in pregnancy? The commonest one are epilepsy, migraine, myasthenia, multiple sclerosis, eclampsia, preeclampsia, CVT, cerebral hemorrhage, and other things, RPLE. So in this one, I'll just rush through this one. I think we better have more interaction rather than the lecture, because there will be a lot of questions in everything here. Now the first case is a cerebral venous thrombosis. We have a 30-year-old female who presented with headache. So it's a twin pregnancy. So as you know, she was on external hormonal treatment for the maintenance of pregnancy. She came with headache, vomitings and seizures. This is the MRI brain you can see, and this is a cortical sinus venous thrombosis. And you can see this here, the left transverse sinus is blocked in this case. So this case immediately, and there is no bleed in this case. This is the these images are doesn't show any bleed. So in this patient, we continued the pregnancy, and this patient was treated with low molecular weight heparin throughout pregnancy and delivered. And after up to 6 weeks, it was given low molecular weight heparin. Afterwards, it was changed to aspirin. So all the thrombotic profile was negative, and patient was successfully delivered after LSCS, and heparin was continued. So the greatest risk period for CSVT in pregnancy is in the 3rd trimester and the 6 postpartum and 6 weeks of postpartum. This one. So in CVT, 80% of the cases are due to pregnancy. Of course, in purpurium also it is very common. Now, if you see the cerebral venous sinus thrombosis, headache is the commonest symptom, and if you have, and you can have any other symptoms of raised ICT features, and also any focal symptoms like any weakness or seizures. So here diagnosis is by MR venogram, which is very safe. We need not worry, but usually we try to avoid unless it is proved, unless we have red flags in headache, because most of these patients, they present with headache. And the anticoagulation is the preferred choice, and we prefer the low molecular weight heparin, and oral anticoagulants are avoided. And the prognosis seems to be very good in these patients. So CVT is one of the commonest stroke in pregnancy, and I think everybody should be aware of it. And any patient who presents with headache with red flags like neck stiffness, recent worsening, first onset of headache during pregnancy, and especially papilledema and other things are there, definitely these cases should be suspected as a CSVT. Now we have a epilepsy patient. We have a 32-year-old lady with 15 weeks of gestation. She presented with status epilepticus. This case, status epilepticus is, in spite of giving 2 drugs also, patient has seizures. Of course, this patient is super-refractory status epilepticus. That means when you give 2 conventional anti-epileptic drugs, then afterwards we give anesthetic agents like barbiturates, and then or propofol or midazolam. So this patient still had a seizure, and this case is very challenging. This patient, you can see this is the bedside EEG, which is showing continuous EEG activity in this patient. So we gave full loading dose of anti-epileptic drugs, anesthetic drugs. So it is a supra-refractory status epilepticus. Generally, these cases will have a very bad prognosis. Not very bad, I should not say, they have bad prognosis in terms of mortality and morbidity also. You can see she was on plenty of lines, and she was ultimately discharged with, after giving, we tried all the medications. You can see the big list of the medications, and she was there with us for 44 days. Thanks to the patient, and thanks to Anita madam also for referring this case. And patients are also, she stayed with 44 days with us. So this patient ultimately, after giving so many drugs, it could not succeed, and ultimately we did electroconvulsive therapy. That is a very, very rare thing, which is usually only in literature few cases were done. In this case we have done, and we presented in the epilepsy forum also in this case. So this case has earned a lot of respect to the hospital and for me personally. So you can see this is the case of, this is the follow-up case. I should not show you more time. So the take-home message is, if it is a first seizure, if any first seizure patient, don't treat inadequately. Most of the neurologists and gynecologists, they treat half. They give small doses of anti-epileptic drugs, which ultimately they can go into non-convulsive, they can go into status epilepticus. So continuous EEG monitoring with bedside EEG really helps us. So this patient has undergone continuous EEG monitoring for the whole 44 days, 30 days of the 44 days with us. So epilepsy is one of the common neurological conditions in pregnancy and prevalence. And so if any case who presents with pregnancy in third trimester, we should definitely suspect preeclampsia, preeclampsia and eclampsia. And AEDs may contribute to the congenital anomalies. And during pregnancy, seizures usually don't increase, but sometimes they may increase. So generally, what is the cause of increase in epilepsy in pregnancy? Of course, the drugs get diluted because of vomitings, because of anything. But this is all literature. But actually, in practice, if you see, fear and stopping the anti-epileptic drugs. Most of the mothers, they don't tell to the husband or they don't tell to the doctor also. They stop the drugs because fear of teratogenicity to the baby. That is they are ready to sacrifice because for the baby. So that's the one thing which you have to closely always interview the patient. They should be always counseled to take the medications appropriately.